All right, thank you so much for your time.
Oh, you're welcome.
Why don't we start with you telling us a little bit about how you ended up at UT and what your job is here now?
Sure. So I trained at Baylor. I'm originally from Texas. I did medical school and internal medicine across the street at Baylor. And then I went to UCLA for infectious disease fellowship and I joined the faculty there. And um, we really came back to Texas for family reasons. And in 2016 or so, a research faculty position opened at UT. And so we seized that opportunity. And for me, it was the right opportunity because the major HIV clinical research site in Houston is at UT. And so that's what I do. I'm an HIV clinical trials person. So it was a perfect fit, and we moved here about 5 years ago.
It's exciting. Tell me more about the HIV program here at UT, if you don't mind, just a little bit, both clinical and research.
Sure. So Thomas Street Health Center is the HIV clinic for Harris County, where Houston is located. And it was the first freestanding HIV clinic in the US, actually. And it's a very large HIV clinic. We serve about 6,000 adult patients a year. And UT, it's staffed by UT and Baylor together. So it's a collaborative effort over there. And we have had for almost 20 years an HIV clinical research program that was funded by the NIH as one of their clinical trials network sites. Recently, we've also become a site for their HIV prevention trials network. So now we have expanded to do a lot of HIV prevention work in the community as well. And that has really brought us more into the community, and we're doing a lot more grassroots and um, work that is partnering with community organizations, et cetera, than we have in the past. So that's an exciting new thing that has come. But we've been doing clinical trials in the HIV treatment space at UT for about 20 years, and that has been led by Dr. Roberto Arduino. And also about 25 years ago, he started the HIV Medicine Fellowship, which is an HIV primary care fellowship. So it's not restricted to infectious disease trained people. Any family medicine or internal medicine or other primary care provider can apply to the HIV Medicine Fellowship. And it's 1 to 2 years. It is based at our Thomas Street Clinic. It's an outpatient um, clinical care fellowship, and then it also has a research component as well. So if that's not the oldest HIV fellowship in the United States, it's one of the oldest for sure. And so we're proud to have that and to have kept it going for the last 25 years. And last year I took over as the fellowship director for the HIV Medicine Fellowship, and so that's my role there. We have up to 2 fellows at a time, usually one, and they work very closely with our faculty, being the only fellow and being at the clinic all the time. And they also engage and do a lot of education with the residents and the medical students.
It's so interesting because I understand that HIV, fortunately, has become less and less common across the country. But here in Houston, we haven't really seen that. Um, do we know why that is?
Our rates of HIV, unfortunately, have not gone down. Our rates of new infections in this area, in the South overall, but some people have called Houston the HIV capital of the South, which is not the the title we wish to have. We have there's still a lot of stigma. There's still a lot of miseducation, and to be honest, HIV services at other places throughout the United States, I can say, having worked there, really expanded when Medicaid expansion happened some years ago. And when Medicaid expansion did not happen in Texas, HIV prevention and care services also did not expand, nor did the social services that are needed for a lot of folks who are at risk, be it mental health services or substance use treatment services, et cetera. Those did not expand either. And so, um, risk reduction and harm reduction services to allow us to effectively combat the HIV epidemic locally, we're not supported in the way that they were supported in other places in the United States. And so that definitely contributes to our local epidemic. But there are a lot of factors. I mean, it's really a complex set of issues around why we continue to see um, new, the same number of new infections, and the demographics of those have shifted over time. But you're right, the numbers are staying the same, and it's a major problem. But it's a great time to get into HIV care. A lot of people think that it's an easily treatable chronic comorbidity now, but they don't realize that there are a lot of facets to it, and you can specialize in almost any of those, or you can be a generalist, just like in internal medicine. So it's a very interesting field to go into, and I think a lot of people who are not infectious disease trained, really enjoy it for those reasons.
That's definitely true. I mean, we send residents, as you know, to Thomas Street for Continuity Clinic now, and even for some of the subspecialty clinics. I think that that's one of the very interesting things about Thomas Street. Would you mind talking a little bit about the subspecialties other than infectious disease that are at Thomas Street that residents can rotate through?
Sure, we don't have everything, but we do have a large number of subspecialties. So we have gynecology and obstetrics. Um, it's mostly gynecology at Thomas Street. When our HIV positive women are pregnant, they actually go to Northwest Clinic for a while and are cared for by one of the obstetricians over there. But so there's women's health, we have rheumatology, we have endocrinology, we have dermatology, we have pharmacists, PharmDs, who do a lot of subspecialty care, whether it be, anticoagulation clinic or diabetes management in terms of medication titration and education. We have substance abuse counseling there. We have psychiatry. There's now a neurocognitive expert from psychology or psychiatry, Dr. Fields. I apologize. Um, and so he does neurocognitive assessments on our patients. So it's just a very wide variety.
Yeah, it's a very rich training environment for the residents. So then another question that I wanted to ask you was about the research opportunities for residents or trainees within HIV. What have you seen as far as those opportunities? Is it available to them, or something mostly just faculty get involved with?
It's definitely available because we do clinical research, and clinical research tends to take a little bit longer. It's often a more longitudinal experience that is possible, and so sometimes if you have a month for research, it's if there may be something that you can write up as a case report or a very quick literature review or something, but to actually initiate a research project with us and to go through all of the IRBs and to complete that, that's a more longitudinal process. But for people who are interested, we really welcome that, and we enjoy taking people on for those longitudinal experiences. We think they get a lot more out of it than just a quick case report write up, because you can do that in any setting really, and we have some unique things to offer, and we encourage people to answer their own questions. I mean, folks can come to us and learn what we do and see what we have available, but the database with 6,000 patients for the last number of decades is so rich. We really encourage residents to ask their own questions and develop their own projects whenever possible. And it's also a very rich environment for anybody who wants to do quality improvement. And we would love some projects in that space as well.
Wonderful. Is there anything else that you think residents should know about HIV or ID or Houston um, as they consider our program or make the decision about residency?
Houston's a great place to live. I mean, I think they'll hear that from other people, but the diversity of Houston is also really reflected in our HIV clinic. And so it's a wealthy experience from that standpoint. And I think I would just kind of emphasize how diverse the fields is. I mean, am infectious disease trained and I do clinical research, but actually I do research in metabolic diseases. So I focus on fatty liver disease and cardiovascular disease and other things that are not traditional infectious disease. And other people focus on prevention or you know, more psychosocial aspects of our patients and their lives. And so I just think that sometimes we don't adequately get across like how diverse the field of HIV is and how there really is something for everyone.
Thank you so much for your time.
My pleasure. Thank you.